Ooh.
Hi, Dr. Sabine.
Yes, Miss Abba.
How are you doing?
I'm doing well, thank you.
Good, good, good. How was your Sunday?
My Sunday was good. I have to say that I'm celebrating my daughter's 8th birthday, so this is great time.
Oh, that is
Yeah,
so good. Congratulations. I mean, the Dutch will congratulate you, her mom,
yeah.
and the
Everybody I
grandmother,
know.
anybody.
Yeah, the neighbors, the cat, the dog, everybody. Yeah. And
Ab-
it's funny. This is the second time we meet, and I'm always celebrating something. Right? Last time we met, I was celebrating my adopted daughter Abigail's birthday,
yeah.
and now it's Estelle's birthday. So I'm very blessed. I feel very blessed.
How is she?
She's good. She's happy. Yeah.
That is good. Have
She's
you
with
been
her.
able to
She's with
like
her dog. Yeah.
right? And have you been able to like relax a bit for this weekend? Because I know for doctors it's quite hectic.
It's okay. So in the weekends, this weekend I'm not doing any shifts. I'll be doing some shifts in about a week and a half.
Yeah.
Uh, so this has been a pretty relaxed weekend. Yes, I must say for sure. And I want to bring out a shout out to every single doctor working in the first aid intensive care in any unit where this coronavirus is really taking its toll. And I
Yeah.
want to thank them for all they're doing, their efforts, and I also want to tell them to think about themselves, to take
Yeah.
the rest that's needed, and they also need to put themselves first and their family, but because it can be quite stressful.
Yeah. Absolutely, absolutely. So I know we've had you on the show before, and it was so good. Even I had to make sure the podcast came out already because it related to African health, and you being the founder, actually the mastermind behind Hello Doc, which is the online platform for people of a diverse cultural background, doctors preferably,
Yeah.
and who like to it's basically like a sharing space, for health specialists, if I say that right.
It's a space where doctors of diverse cultures can come together and offer their services and help people from those different cultural backgrounds to navigate through the healthcare system in the country that they live in. And I think
Yeah.
especially a country like the Netherlands, where there's such a huge amount of internationals coming to the Netherlands at this time, we
Yeah.
need to also understand that a lot of people don't understand the Dutch healthcare system.
Yeah.
So, and I think the doctors working on on the platform that I built, they understand the platform and the system very well, and they can help navigate foreign students,
Yeah.
expats coming into the Netherlands. So that's really good. So they are multilingual and multicultural, and that's what really stands out in this kind of platform. Sure.
Love it. Love it.
Yeah.
And just for those that might have not, known you before or know heard of you, could you share with us who is Dr. Fonderson and where's the doctor about?
Well, okay. So first and foremost, I always say this: I am Sabine. I was never born Doctor Sabine. My my birth certificate just says Sabine Fonderson. I was born in Cameroon, and I lived there until I was about 5 years old, and then moved to England and just moved around with my father. I come from when I say my father, my parents and my brother and sister. I
Yeah.
come from a very international background. So my grandfather used to be an ambassador for Cameroon. So his
Right.
life gave me an
Diplomatic
opening,
life.
diplomatic, yeah, and it gave me an opening to understanding what life in outside your country of origin means. So I've been very blessed to be able to have worked and lived in very different countries. So that's something so that's really my background, right?
Yeah.
And the doctor part came when I was about 16, 17, when I kind of was trying to figure out what I wanted to do with my life. And I was talking to my mom about career options, and we were just going back and forth. And I
Yeah.
just all I knew is that I wanted to travel. And then she said, well, just do medicine. And I asked her, can you travel and be a doctor? And she said, sure. And I said, well, that's what I'm going to do. If I get to travel and help people, then I want to do that. So ended up studying medicine in Leiden and
Yeah.
graduated in 2006, and I've been a doctor since 2006. So yeah.
here you are.
Here I am. Yeah.
So if we talk about you being a doctor, could you like outline for those that don't know medics or whatever, what specific doctor are you? Like what can people run to you for?
Well, first and foremost, I'm a doctor that listens. I know that other doctors don't. Obviously, we all listen, but
Yeah.
what I mean by that is that I really want to know, let people know that I'm very much engaged, not only their medical condition, but also
Yeah.
in their yeah, in the mental health, in their social health, everything. So I'm kind of like an all round doctor. But if you look in the terms of speciality, I graduated in 2006, and then I ended up doing emergency medicine for many years. So
Hmm.
I've like over 7 years experience in emergency medicine. Most
Yeah.
of it was done in England and Scotland, and I even uh, got a second master's in pediatric emergency medicine.
Hmm.
And then I came back to the Netherlands in 2017, and I thought to myself, okay, what do I want to do? I know I want to work with children, but I
Yeah.
wasn't sure yet where I wanted to go. And emergency medicine really took a toll on me, also physically.
And
Um,
imagine
it was, yeah, and
workload.
I have a lot of respect for my colleagues in that field. But because I was a single mother, it was quite hard to combine the two. So I had to make a decision. So I've now
Yeah.
shifted into research. I'm doing a PhD, and I'm also now training to be a general practitioner, which is where Hello Doc comes in really handy. And I'll tell more about it later on.
Yeah. Awesome. Awesome. So you had really a good time to figure out what you want to do, what suits you in terms of medication and the health, the whole because I know the body of human being has so many components, and even in doctor's world, everybody is specialized in their bit. So to become a GP is pretty much like a lot, isn't it?
It is. And after coming out of the world of emergency medicine where you see really acute things, you see people with life and death situation,
Yeah.
switching to general practice is really quite different. And I kind of thought, oh well, if I've seen people with heart attacks and brain trauma or head injuries
Yeah.
or strokes or severe, I mean, things where you really need to act now is going to change somebody's life, and then switching to general practice, it was quite tough. And I'm
Yeah.
learning a lot. I'm learning a lot more about communication. I'm learning a lot more about using the limited tools that GPs have in order to diagnose. And people underestimate the amount of work and thinking that a GP has to do, because it's so different in the hospital setting when you have all these tools and equipment and personnel. You
Hmm.
can really help. We work as a team to diagnose, right? We work together. But the GP setting is very much a solo practice. You're alone, and you have all but five little tools to kind of come up with these diagnoses. And what I mean by that, I'm talking about the blood pressure measurements. I'm talking about the oxygen saturation measurements, uh,
Yeah.
the stethoscope, and if you're lucky, you can do a urine examination just to see whether or not somebody has a urinary tract infection.
Hmm.
And you're limited. But with those tools, you're quite powerful because you can do a lot, knowing how to listen and how to take patients complaints and put them into place. It's all about fitting that puzzle.
Yeah.
So GP world has really taught me a lot about that. What I mentioned in the beginning, I'm a doctor that listens. I've really learned to be a communicator and also a
Yeah.
participator, and let people communicate back to me what's going on. And that's what I think is a strength also about Hello Doc. I can get that skill back into my team, and we talk about these things every week. We have meetups, and we talk about, okay, what can we do better this week? How can
Yeah.
we serve our patients or our clients better? And a lot
Yeah.
of it has to do with, like, okay, what kind of questions can we ask them to make sure that they give us the right information so that we can help them better.
Yeah. Wow. So let's talk about this crazy time that we're in, COVID-19. I mean, it's crazy. Have you noticed any of this craziness in your working field? And how
Um,
have you?
Yeah. So about, I think we've all, especially in the Netherlands, I think it's really hit us about 3 weeks ago.
Yeah.
I remember, I'll kind of give you a journey as how
Yeah.
this thing. evolved.
Yeah.
So let's say that around the last week of February, people started hearing things about this coronavirus and people getting sick in China, and it
Yeah.
was in the news, and it was more like, oh, it's a Chinese thing, and
Yeah.
it will die down, it will stay there, and I'll never forget that the first
Mhm.
week of March, it was the 2nd of
Yeah.
March, and at that time, I was already quite apprehensive because
Mhm.
on the 12th of March, I was supposed to present my research findings at a conference in London, and I'd already bought the ticket. I was supposed to travel, and I remember that on the 2nd of March there was already, I think, one or two cases in the Netherlands, but I was hearing about China. The cases were in the 20 or 30 thousands. Oh well, I think at that time about 20,000, and I thought,
Yeah.
well, if it's getting bad there, and there's already two cases in the Netherlands, and there was, I think, about 10 in England. I was like, what is going on with this coronavirus?
Yeah.
And on the 2nd of March was the first day that I was actually starting working in a GP setting. And I remember telling my colleague that, well, next week I'm supposed to travel to London, and I'm worried that if this thing goes the way I think it is, there might be a lockdown. And I was
Yeah.
more worried about coming back to the Netherlands because I had my daughter here, I had
Of
my
course.
dog here, and I thought if something happens and I can't come back to the Netherlands, that would really, that would destroy me physically and
Yeah.
mentally. So she and I remember that on the Wednesday, which was the 4th of March, we talked about it, and I said, I was just like, I don't think I can go to London. It doesn't look good because by that time numbers were rising.
Yeah.
And then by the so with the 4th is a Wednesday, Thursday, yeah. By the 6th of March, I'm talking to my professor where I do my research and saying to him, I don't really feel comfortable going to London next week Thursday because of this rising corona thing.
Yeah.
And my main worries is that I won't be able to travel back. And he said, look, Sabine, we cannot force you to go. You've already bought your ticket, but we understand if you can't go, we won't hold you back. So I said, well, I'm not going. And I remember telling my
Good
colleagues,
choice.
yeah, I remember telling my colleagues, I'm not going. You guys figure it out, but I know that I can't go there. And a week later, on the Tuesday, my professor sent out an email to all of us who were supposed to go, saying that they've decided that nobody's going. We either go, all of us, or we don't go.
Yeah.
And it was really a good decision because I mean after that it's kind of just snowballed into this huge thing. So when I look back at corona, I think it was very serious. It was, and it is a serious thing, and I would want people to know how serious it is. And I hope
Mhm.
that you've got questions, and I'm hoping that viewers are watching and they can ask questions because this is quite serious.
Absolutely, absolutely. And on for us, it the seriousness of it's quite slow,
Yeah.
especially you being a doctor. I mean, last time when we talked, you even shared that you had a meeting, and you're probably getting news 4 days ahead of us, pretty
Yes.
much.
Yeah.
So yeah, so you really emphasize how serious this virus is, and people really have to make sure they stay at home. It's
Yeah.
that important. So, could you share a bit of how serious some of the measures that governments ask us to take? How serious are these measurements or these measures?
Yeah.
Sorry, point of
No,
correction.
no, it's fine. I mean, okay. So if you look at the coronavirus, we don't know enough about it for example, know, okay, what is the best treatment, but we do know enough to know how contagious it is, right? So I'm just gonna put out a few pointers out there. Number one, coronavirus is a virus that is spread out aerogenically. So that's by air, by droplets. So coming from your nose, whether you sneeze or cough, there's tiny little droplets where the virus actually survives, and that those virus particles can then spread in the air about a distance of about 2 meters, 1.5 to 2 meters, and they can also deposit on certain surfaces like the table, wood, plastic. For some people are saying between 7 hours to a little bit longer. Now, the
Yeah,
most important thing is that if somebody has the virus, it's only pretty much contagious when somebody has fever and they're coughing. The fever being that it 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 really tells us that the virus is active in your body and your body is doing its best effort to fight it, right? And
yeah.
that's when the virus is at its most contagious point. And at that
Hmm.
stage, it's highly, you can transfer the virus to somebody else, especially if they're a very close distance. Now, typically, somebody can still be asymptomatic and not have features of the virus, and I'll talk about the symptoms later on. But let's say you have the virus and your body's able to fight it off really fast, and you don't have any symptoms. You can still spread the virus, but it's only going to be about 10% transmission, right? And
Yeah.
typically, one person who has an active virus is able to transmit to two or three other people, and
Hmm.
those can transmit to two or three more other people. And that's what makes coronavirus a little bit scary, because it only takes one person to infect three, and those can infect three more. So the scale of it infecting more people is a lot higher. And that's what I think that the policies and health professionals and ministers are doing their best to let people know to keep their distance, simply because of how contagious it can be.
Yeah.
The other thing to take about seriously on this case is that this virus can have really bad consequences, especially for those who are in health, let's say risk groups. And what is a risk category? Those are the elderly, huh? So anybody above the age of 70 can be a risk group. Anybody who has known lung disease, heart disease, diabetes, or obesity. And the reason being, in all those risk groups, your immune system is just not strong enough. And you need a
Mm,
good immune system to be able to fight off this virus. Full stop.
right. Right. So does it mean that people that have a good immune system probably have fought it off without them realizing they have it and just thought maybe it's a flu? Let me make sure I'm warm enough. I drink this, I do this, and then it leaves. And is that possible, or is it really that aggressive?
Well, that's a good question. So we know from studies that the majority of people who do contract the virus, they will not have severe symptoms, right? So I usually tell my clients or my patients this: Corona is like this. You can have mild symptoms, mild to severe, severe, or worst case scenario, right?
Hmm.
And worst case scenario is you being in an ICU ventilated. Mild is you having cold symptoms with a little bit of runny nose or sore throat. Mild to severe is a little bit fever, coughing.
Hmm.
Severe is when you're coughing, you're having fever, and you're short of breath. And
Hmm.
worst case scenario, it's when you end up in ICU, right?
Yeah.
So, and the majority of people really typically have mild to moderate severe symptoms, and then it just basically says your immune system is able to just fight this virus, just like you would if you had a flu. And I
Hmm.
think you've had the flu, I've had the flu. We know what the flu feels like. It's awful. You've got body aches for a couple of days. You have a stuffy nose. You're coughing. You feel awful. And
Yeah.
that's what coronavirus does. So you've got mild to moderate symptoms. But the moment that you start having, moderate to severe or severe to really, worst case scenario, this is where things can get really drastic with corona, is because in that 2 or 3 days, when you're kind of having these symptoms, you can crash really fast, and nobody understands why this is. So this is something that is also very disruptive for a lot of medical doctors. We don't understand why people crash so fast.
Yeah. Yeah. So it's even so the symptoms surprises everybody, not just the person involved,
Yeah.
medical doctors as well.
Yeah, absolutely. I mean, we've seen people who come in and they look, they're able to talk. They look like, and I say, well, I mean, you can tell that they're not that sick, but you wouldn't think they were that bad until, we do some measurements, we check their oxygen levels, or we listen to their chest, their lungs, and we're like, wow, this looks really bad. And then within hours, they crash completely. It's like if their immune system is just giving up, or the virus is so strong it just completely floods the lungs, and they just can't. They have to be in on ventilators or even resuscitated. So it's one of those viruses that if it was just the flu, yes, a lot of people do die from the flu, especially elderly people. But
Yeah.
this one, it just takes them really quickly, and there's not a lot people can do at that stage.
Yeah. I see. For those of you who just tuned in, shout out to Kafui Henor, shout out to Evans Asamoah, Mami Anima, Deborah Jackson. Some of you who just tuned in, I am talking to Dr. Sabine Fonderson, who is one of our special guests who came on the show a couple of weeks ago. And she's also the founder of a health platform. Let me just summarize it as that, a health platform.
Yeah.
Hello,
Yeah.
Doc. And since we are in this crisis, some would call, I thought, let's have her back on the show, and so that she can explain what this means for us Africans, especially us Black people. What does this mean for our health? What are some of the myths, the facts, and the truths, the things that we should really be aware of in this period? So basically, Dr. Sabine, at the beginning stage of this, which for me also was that first week of March, and then the second week of March, things got a bit more intense, or let's just say the virus got closer here in the Netherlands, and
Yeah.
government started to take more measures against it. A lot of Black people were like, you know what, this flu is not as severe as on Black people. We knew the facts surrounding old people. What are some of the crazy things that you've heard, and some of the things that are actually not true that have been going around?
Well, I think that one of the things that I feel unfortunately I want to say bad about, but it's again it's not based on what I think at this stage. But the government in the beginning thought about herd immunity, right? Saying
Yeah,
that, oh, it's okay, go out, mingle with people, get the virus, get infected, because once you start forming antibodies and your body starts
right.
fighting, then you will be immune to it. Just like when you go, every kid, well, let's say 90% of children develop chickenpox, right? So when they
Yeah,
get into contact with other children with chickenpox, typically a week or two afterwards, they too develop chickenpox. So I
yeah,
think the health officials led government officials to believe that herd immunity will be the best thing. So what
yeah.
happened was that there were all these corona parties being thrown, and people were getting together in parties and little, nightclubs, and they actually
Tequila
called it
party.
corona, yeah, corona parties.
Right.
Unfortunately, these corona parties have had devastating results, and I'll tell you a little bit about it. Corona parties, where people who were might not have been symptomatic at the time, but were carrying the virus, actually infected others, and unfortunately, some of these people have succumbed to the disease. So it's something that I think we need to be very conscious about. And I know from secondhand information, not from me, but from a very trustworthy source, that a corona party had been held in a city of Cameroon called Douala, and
Hmm.
from my to my knowledge, 4 people in that party have now succumbed to coronavirus. So it's really important that people understand that, yeah, you might be African, we're known to be very resilient, very
Yeah,
strong, but this particular virus has no does not discriminate. And I'll give you
yeah,
another example. So in Brazil is another country where I think that they're probably doing uh, a disservice to their people, because they feel, especially the health officials or the politicians, are saying that, well, Brazilians are fantastically safe. There's no virus that can take us, and even so, we can survive everything. So a lot of Brazilians ended up having festivals and weddings and all these social gatherings, and a few of the high profile Brazilians have actually succumbed to the coronavirus. So
yeah,
what I mean to say is that you might be rich and famous, you might be poor and living in the gutter. Corona does not discriminate.
yeah,
So please make sure that you do follow the current guidelines. And I know it's frustrating for a lot of people because it can change from week to week. And the
yeah,
reason why it changes, and I want to employ people to just be patient, is because we don't know that much about this virus. And it's 3 weeks ago we were hearing that it only affects old people, and
yeah,
now 3 weeks later we're hearing it affects young people. The first infant died of corona 2 weeks ago in the United States, and then 2 days ago, yesterday, a 5-year-old child in the UK unfortunately passed away from this. So when I say that this thing's serious, I mean it.
yeah. Yeah, and the reason why I'm actually I was a bit laughing, that is because I regard this as no respecter of person, no respecter of class, position, or whatever.
Yeah,
And it goes totally against what we're normally used to,
yeah,
well, our position in our class or our money saves us,
yeah.
but in this case, it's just, it doesn't care. And
No,
now to also learn of that children,
yeah,
are a victim of this, it's really, it's heartbreaking, and for some people
absolutely.
very scary. So with these children cases, do you know, are these cases of where they had some of these sicknesses that you mentioned that weakens the immune system? Was there any case of that, or?
A very good question. So obviously, I don't know all the details of these individual cases, but I do know for infants, typically an infant that's less than 1 year old, the immune system is going to be relatively weak, right?
Yeah.
They haven't had enough exposure to viruses, all common types of viruses for their body to create antibodies, and furthermore,
Hmm.
an infant of less than 1 year hasn't been fully vaccinated in order to get their body to actually start making these antibodies in order
Yeah.
to fight off any virus. So I think that any child who's less than 1 years old is going to be at high risk, and I think that health officials should start publishing that also, and saying that regardless of age, especially the young and the older, are going to be risks to succumbing from this virus. I think the more data we get, the more we're going to realize that this is going to affect especially the vulnerable. And typically in medicine, the vulnerable are infants and the elderly. What we have seen is what we knew from the beginning, especially in cases that happened in the UK, where a lot of them, like the first 2 weeks, the people that did succumb to the disease were, and if they were young, so let's say less than 70 years old, they all had comorbidities. So they had either diabetes, or they were overweight, or they had pulmonary symptoms. But what we're seeing
Yeah.
now, more and more, reports are coming, especially from places like in the United States. Those who are succumbing to these diseases have no prior morbidities, no prior diseases. So that scares me also. So it means that if things are shifting with this virus, and it's no longer about, oh yeah, the elderly are affected, and now we're looking at people with comorbidities, and oh wait a minute, actually this person who passed away was 36 years old and was never sick. Wait a minute, we need to really think about this as something extremely serious.
Yeah. Yeah. And from what you know, because you coming from your work experiences and the clients that you deal with, you're an international doctor.
Mhm.
And you probably have data on this crisis coming from the States, as you mentioned, the UK, France, the Netherlands, and all of these countries, where most of us are like semi isolated, I would say. So, based on all of these different data that you have, what would you recommend somebody to do and be precautious who lives in the US different from somebody who's living here? Are there any differences, or is it one and the same recommendation that you would give them?
I think I would give them the same recommendation, simply not to confuse people. Because at the end of the day, if I'm already saying that this virus does not discriminate, then there's no point in giving different recommendations. So
Yeah.
everybody must follow the same line of practice. What I would say to people right now is that considering things in different countries. So, for example, let's just talk about the Netherlands, right? In the Netherlands, at the moment, it seems to be that the rate and the amount of infections are not as steep as other countries. That might have to do with the fact that from pretty early, I would say, the government did switch quickly to the social isolation policy. So people were staying indoors. They were really committing to the 1.5 meter distance. They were being, upholding hand hygienes. And if they did need to go out, it would be one person only, etc., etc. So for that, I would say maybe that's helped with containing the infection rate, and maybe also the death rate.
Yeah.
However, in the Netherlands, they're not doing a lot of testing. Germany, on the other hand, is doing extremely a lot of testing, and there seems to be a quite lower death rates compared to the other countries. Now, if you
Mhm.
look at England and in the United States, where the death rates, especially in the United States, is increasing rapidly, Italy, up to about a couple of days ago, let's say last week, was having a humongous rates of death. Spain also, and they kind of went into the lockdown about 2 weeks into their corona crisis. So what
Mm.
I would say is that everybody should maintain the same protocol, which is distance, especially if you don't know the people where you're going. If you have to go to the shop, try and keep it to a minimum of one person. Hand hygiene, and if you have fever and if you're coughing, please contact health services. But that's the reason when you should not go out. That's when you should not have contact with other people outside your family member, obviously.
Yeah,
And then I want to talk a little bit about the symptoms. When I
sure.
talk to my clients and they are worried about having corona, I say to them, okay, look, at the moment, I will look at three things that are important to me. If you have fever, and anything above 38 degrees for me is a fever. If you're
Mm.
coughing, whether it's coughing, dry cough or phlegmy cough, it doesn't matter. And the
Yeah,
third thing, which is the most important thing, are you short of breath? Well, they say to me, well, I don't know, I feel short of breath. But when they tell me, but actually I felt short of breath, but I had a nice walk around the park, that's not short of breath, right?
yeah.
They tell me I feel short of breath, but I was able to walk up and down my stairs, or I was able to take my dog for a walk. That's not short of breath. Short of breath means for you to get up from your couch to your toilet, or from your bed to the kitchen. You cannot even do that because you're really out of breath. That's when you know that things are serious.
Mm. I see. Okay. So looking at the measures that we're taking, like washing our hands and, staying clean, extra clean. I heard
Something
some.
we're doing anyway, right?
Exactly, exactly. Somebody said, you know what? Why are we even using hand sanitizers? It's about washing your hands. These hand sanitizers don't make any sense. Is there some truth to these type of comments?
Well, I think yes and no. So washing your hands, if you're using soap, then you're fine, because
Right.
soap in itself, it has a component that breaks the cell wall of the virus. Okay, and so
Yeah.
but if you're not using soap and you have the hand sanitizer, which has a certain percentage of alcohol, that would also break the cell wall of the virus and kill it. So either way, if you're washing your hands, just make sure you're using soap. And if you're
Mhm.
not, if you don't have soap and you use alcohol, go ahead and use that. So either way, it works. But you need to use this a soap or a good hand sanitizer, like with the appropriate amount of alcohol.
So it's a good measure. And what about coming home, taking off your shoes because they say the virus can stick on your clothes, something like that. I don't even remember it all into the details. What
Yeah.
about that piece of information?
So that's a good question. So imagine 3 weeks ago when these things we were getting news. I was going to the GP practice. I was having people cough all over me, and nobody was telling me about getting protection. And
Yeah.
I've been working as a doctor for many years. I cannot tell you the amount of times people have sneezed on me, coughed on me, vomited on me. So it's always been something that I'm used to. So all of a
Right.
sudden, yeah, and all of a sudden I had to wear this protective gear, and I'm like, since when do I need protective gear?
Yeah.
I'm used to people doing all this stuff. The reason is that they found out that this virus can stay on surfaces like your clothes for a few hours after it's come to contact. And so what I even do, especially for Hello Doc, if I do home visits for my clients, I put on my scrubs, right? So I wear my scrubs, and then as soon as I leave my client and go home, I take off the scrubs and put it immediately in the washing machine to
Yeah.
wash. So I would advise that once you come, if you it's hard, right? It's hard to say that, okay, every time you go out to the shop, you come back, you have to clean yourself. I would say wear, find an outfit, one outfit or two outfits that you can just get off and then put it straight into the washing machine, and then wear your other outfits. But once you get home, typically
Yeah.
you want to get straight into the shower or change clothes. You really do.
I see. Shout out to Mamia who says, very interesting. Thank you, doctor. Thank you
You're
also
welcome.
for engaging into the conversation. And colleague Mensa Gary, who says the world is sick right now and everything isn't normal anymore. To that, I would definitely say that's very true. Our life is just put on a hold onto something else. And for those of you who just tuned in, shout out to Patrick Owusu. We're talking to Dr. Sabina Fonderson, who is an expert when it comes to health. And we are talking about the truth, the myths, the facts surrounding COVID 19 so that we could stay informed and stay protected all through this while. So, Dr. Sabine, I would also like to know because here, this sort of is we're right past flu season, if I might call it like
Yeah.
that. And there are also some things that I've read that the virus probably can't exist above the temperature of 27 degrees. However, we do see some few cases popping up in on the continent. You know, and some say, you just have to boil water, over 100 degrees, and then just put some, what's it called, inhale some warm water and stuff like that. What are some truths about this? Is there any truth about this? And do you expect for this to cease if we're going into the summer where there are higher temperatures and less flu cases?
Well, I again, unfortunately, we don't know that much about this virus because people have to remember this virus was only discovered in around November 2019. So the
Yeah.
19 comes from the fact that it was discovered in the year 2019. So it's still a new
Right.
it's still a new virus, and we don't know that much about it. So only time will tell, and that's why it's really important to keep to these. They're very harsh and they're very hard. I swear this is probably the hardest thing this generation and maybe our next generation will ever go to. And when people talk about it feels like a war, like we're fighting a war, yeah, because in
Yeah.
war, it's times of uncertainty, it's times of distress, it's losing your job, losing loved
Yeah.
ones for things that you can't explain. So when people say, okay, in the summer, the heat will decrease the viral load. Actually, I'm scared because in the summer, that's when everybody goes out. In
Yeah.
the springtime, summer, that's when a lot of people have allergies, they're coughing, they're sneezing. I happen to be a
Right.
sufferer of allergies, so I don't want to be going out where there's a lot of public people because I am going to be sneezing a lot more than normal.
Yeah.
And people will be looking at me funny, right? Because they're like, "Do you have corona? Why are you sneezing?" Uh, so, so I want to be careful about that. So the summer, the fact that the warmth is coming doesn't say much. And let's just be honest. Let's look at it realistically. Corona has hit practically every single country, warm, cold, you name it. It has been affecting a lot of people.
Yeah.
So nobody can tell me that the heat is going to kill it. At least there's no evidence for that.
Yeah.
Yes, go ahead and boil water. Don't drink the boiled water. You can use that water. You
Right.
can use that water for washing or for cleaning. That's always good, despite of corona. But I wouldn't say that there's any truth to these myths. And what I want to also mention is that a lot of people now are listening to the news and media and hearing things like, oh, we should go and stock up on antibiotics, or we should go down and stock up on NSAIDs, which are anti-inflammatory medication. And even worse, people want to stock up on anti-malarial drugs. I want to tell
Mm-hmm.
all these people who are stocking up on these things, there's no evidence that it works.
Mm-hmm.
And by taking these medication off the market, you're also preventing people who really need it from
Yeah.
getting treatment. And let's not forget that before Corona, there was other medical issues, and there will still be other medical issues in spite of it. So let's remember those people who need it instead of stocking things that are not yet proven to be effective.
Yeah. So a lot of them then are actually myths. I would only hear you say about the hot water that for it to be partially true, but as for the rest, then I would say they're myths other than boosting your immune system,
Yeah.
we do normally. Then there are a lot of lies going about, isn't it?
They are, and the reason why, and I wouldn't say them as lies. I think it's just insecurities. When people are unsure about things, they tend to want to pretend they know stuff, so they might hear something, use their own perception of something, and then portray that as true or it's worked. And obviously, if something has worked for you, you want to tell the whole world and say, hey, look what's works for me.
Yeah.
And
Yeah.
in time of insecurity, people are going to jump on that train and say, hey, this is the formula. What I'm trying to say is that um what in the medical field where we are right now as health professionals, we are really in a place where we are really unsure typically. And this is what we've done for many years. We
Yeah.
will only let the public know of a drug or a treatment when we know for sure it has benefits, right? And the
Right.
public would never know about it until we start trials, we start testing on animals, then we start testing on volunteers, and it's like, okay, you know what, we're happy to bring out this drug. And it will take years. It sometimes takes 5, 6, 7, 8 years before we actually bring a drug to market. And right now, we as health professionals, like, oh my goodness, we are stuck. We can't come up with a drug right now. And so everybody's rushing for this, miracle cure. And
Yeah.
we need to give it time. I hate to say it, but that's just the case. And we cannot make it go faster, because what I'm worried about this is that if you make it go faster, you start jumping into all these vaccines and producing medication, you can start making errors. All of a
Yeah.
sudden, you're going to bring out a product out there to market because people want it, they want it now, or they want it yesterday, and we haven't even tested it. And what about the detrimental effects it can have in the future? You think about what vaccinations used to be, or testing of drugs in poor countries in the developing world, where they would go out there and test drugs on innocent, vulnerable, poor people, and the
Yeah.
detrimental effect it had on those people for generations to come. I don't want us to go through that ever again.
Yeah.
So I think that we as a nation, as a world, we need to learn from our mistakes and give it time. Just stick to the protocol, stay home, keep to the hygiene. If you're sick, call a doctor. If you have anything else than corona, call me. I'm working Hello Doc. I'm talking to clients every day about corona like symptoms. I
Yeah.
would go into your home. I would go there and listen to you, but you do not need to put yourself and other people in danger for no reason.
Yeah. And so, from what I understand, is that people could contact you through the app,
Yeah.
and then find out more whether they need more information. And I also discovered that you have a free consultation, right? Could you share
Yeah.
a bit more about that?
Yeah, and I'm so glad to say this because, again, because in time of uncertainty, people unfortunately might make decisions or take decisions that might not be the best for them. And
Yeah.
with Hello Dog, we're giving free consultations on Corona for about 10 minutes. And what I do is that I listen to your symptoms and I say, okay, you know what? You sound like you might have Corona. And if you do, it's mild or it's moderate or it's severe or it's worst case scenario, right? And
Yeah.
if I think that it's mild to moderate, I give you advice, and then I say, okay, I'm gonna follow up with you every single day until your symptoms get better. But if I think it's a little bit moderate to severe, then I will suggest maybe me coming home to your home and I actually listen to your chest, because I need a few things. I need to know your oxygen saturation. I need to know how your chest sounds like, and I need to also measure your temperature. Once I get those numbers, I can make a phone call to the hospital and say, hey, listen, I think I have somebody here who has corona. And then we can take the steps further. And the only reasons why I'm doing that is for those people who can't access their GPs, or who've been trying to get their GPs, but the phone has been off, or they've been told to wait maybe a day or two.
The
Because I
phone was
think that
off.
there's some people who've tried to access their GPs, but their GP is sick or they've closed the practice. You need to understand that because of Corona, a lot of GPs now aren't able to see patients at their practice. And if they can't see patients, well, they might end up working somewhere else with another GP. So it's been quite detrimental for a lot of people.
Wow, that
Yeah,
is very interesting. So I
yeah.
would assume that you, when you come and visit them, you're also having the whole gear on and things, because you have to protect yourself as
I
well, right?
do. I do. And the reason why I would come to I that's why we do a video consultation beforehand,
Yeah.
because the video consultation helps me when I see my client. I said, okay, this is somebody who's really sick, right? With my years of experience in the A&E has helped me, or the emergency department has helped
Yeah.
me to assess somebody who's really sick. So
Yeah.
when I see them on video, and if I'm talking to them and they're able to talk in full sentences, they're not
Mhm.
gasping for air, they don't look too unwell, I can give
Yeah.
them advice, and then I can say, okay, you know what, I don't need to come to you now. But I've been to a few clients where I actually put on protective gear, And unfortunately, we don't even have access to that. So a lot of the stuff that I buy is from like what you call it, hardware stores, and I get stuff like the mask that people usually use when they're painting their homes, because healthcare
Right.
professionals don't even have access to the gear anymore, unfortunately,
Oh,
because people have just yeah, stocked on them, and they're selling them now for ridiculous prices. And I'm
yeah.
thinking, in a crisis like this, why would you want to make profit of people's lives? I think it's something that it's quite heartbreaking. Yeah. So that's why I'm giving the 10-minute free consultation, because in just to be very clear, the majority of people who have corona like symptoms are really mild. I just want people to know that the majority of people do not get worst case scenario.
Up until the worst case scenario actually happens.
Up until worst case scenario happens, and typically if worst case scenario happens, so let's just go through the journey. So let's say you have today, Miss Abba,
Yeah.
you get a coronavirus, right?
God
um
forbid.
yeah, God forbid you will not get it, but let's say you did.
Yeah.
So what would happen is that you might develop flu-like symptoms. You might have throat ache, you might feel body chills, you might feel body weakness, tiredness, maybe even a cough. Now, when it becomes really interesting for healthcare professionals is when you start to develop fever. At this stage, the protocol is that even if you have fever, stay home. That's what they're saying. If you're
Yeah.
having fever and you're coughing, stay home, take paracetamol, get some, tender loving care, take care of yourself, get eat well, hydrate well. Now, it becomes critical for corona when your body starts to say, I'm fighting this thing, but I'm not yet there, and your fever persists, and then you start developing breathlessness. It means that the virus has gone into your lungs and it's created a very, very heavy reaction, and now fluid has come into your lungs and you are not able to breathe properly. So lying flat on a bed, on a sofa, is completely impossible. You're gasping for air. That, my dear, is worst case scenario. That's when you need to be in the hospital.
Yeah. It sounds pretty serious. It sounds like a silent killer. And
It is, and a lot of people. The reason why it's a very serious disease for a lot of healthcare professionals is that typically, hospitals are busy all the time, right? People go in, people go out. So you're sick, you go to the hospital, you spend a few days there or not, and you leave. But corona has caused hospitals to be stocked, to be completely blocked. So that in one go, it's a rush of people. And unfortunately, when you're ventilated, typically you're not ventilated for a day or two. You're ventilated for a week. And with the corona, people are ventilated for, more than a week, 2 weeks. And that's what makes it really hard to shift the patient. And I've
yeah.
heard doctors in America actually sending people home on oxygen, and I predict that that's going to be the future, where people, if you can manage oxygen at home, that's where you're going to be, and then it will be monitored from there.
Oh, that sounds intense.
It is.
Pretty
It's
much.
really intense. And I
Really
want people to
much.
just really take this as seriously as possible. Take care of yourself. And also know that if you have symptoms that sound like corona, it most likely is, but it doesn't mean that you're all going to end up in worst case scenario. You just have to
Yeah.
monitor it.
Yeah. In the meantime, for those of you who just tuned in, shout out to Nana Kwesi, who says, Hi, Miss Abba and the team. God bless you for your good work. Shout out to you as well. We're just taking in the last couple of minutes as we talk to Dr. Sabine around surrounding this COVID-19 so that we just get some clarity, as to how serious this is. We can protect ourselves, right, and our family and get through this, stronger the better. And also Mensa Gary, who is asking, my question for doctor is, so when will we get back to our normal way of living? I say that it will probably won't be a normal way of living after this, but hey, that's my observation.
Yeah, I agree with you, Miss Abba. I mean, what? Let me just say that we as human beings, we have to give a credit to ourselves for being so adaptable. Okay, I mean, we are so used to a certain pattern. You wake up in the morning, go to your office, go to work, come back home, and all of a sudden, they're like, you can't come to work anymore. Okay, so you go home, and then all of a sudden, you're online. On Zoom meetings, on Meets,
Yeah.
and you're doing stuff online. And I'm thinking, people have adapted to this, and I'm thinking, if we can get through this, we can get through a lot more. We can get
Yeah.
through even a lot worse. So the question was, when are we going to get back to our normal way of living? And like you rightly said, so our normal way of living as it was is over. We have now shifted into a new era. We've shifted into a new way of doing things. We've shifted in a way that we're now, focusing on family life. This is amazing. Let's just focus on this now. You're now at home most of the time. If
Yeah.
your kids are around you, you are now much more aware of what your kids are doing than you ever were before when they were in school. You're now much more aware of what your husband, your wife, your partner is doing at work because you guys are talking about it. I think this has shifted our way of living in the sense that whilst we were using mobile technology to keep in contact, we're now using mobile technology to keep in contact in a much more serious and much more intimate way because now
Yeah.
we're much more closer to each other. Look at the way that people have been boosting each other's energy and efforts by clapping on balconies,
Yeah.
singing songs and making sure that we are staying motivated. This is a new normal now. The
Mhm.
new normal is that we're looking out for each other. We are taking care of that neighbor. Oh yeah, the one that's alone downstairs. Let's just, even though we can't see them, let's give them, let's put like a little package of food at their doorstep. Let's send that other neighbor who's living down the street a package just to say, hey, I'm thinking about you. Normal way of living now is about thinking of each other, and we weren't doing enough of that before. We were way too busy getting on the bus, getting on the train, going to work, etc.
Getting to the bag.
Getting to the bag, getting that money in. And of course, that a lot of people have lost their jobs, and I hate it. I hate the fact
Yeah.
that this has really destroyed the economy, it's destroyed people's way of living. But we will get through this if we just make that mindset, that shift, that using mobile technology to bring us together instead of mobile technology to bring us further apart. That's
Yeah.
the mind shift we need. And that's what Hello Doc does. I'm using the mobile technology now to make sure that people get the medical attention they need despite corona or in spite of. Because, yes, GPs are completely overwhelmed, emergency departments are overwhelmed, but I'm still here. We're still here to listen to your complaints because we want to let you know that that tummy ache that you had before corona is still going to be there when corona strikes, right? And we
Yeah.
still want to be able to make sure that you get the health care that you need and the attention that you need, but now we're doing it in a much more intimate way. Absolutely.
Yeah. So you as a doctor, you know how people are, you know how these circumstances have reached people to come. Have you noticed any other symptoms as like stress levels or other things that have been going spiral as well? Have you
Yeah.
noticed any of that?
Yeah, one of the things that scares me, like I said already, is that we are going to focus too much on corona. We should focus on corona. I'm not saying we shouldn't, but we should not forget that other things also matter. I the last question was, are we going to get back to the normal way of life again? For healthcare professionals, there's going to be a huge pile of work to do once things get back to normal, because we
Yeah.
are now putting a lot of our stress, a lot of our complaints on the side because everybody's focused about corona. Oh no, I don't want to call that GP because the GP said don't call me unless it's corona, or
Yeah.
unless you're pretty much dying.
Yeah.
Hospitals are blocked. They're telling you go home, don't come here. So I'm afraid that we're going to see a secondary or preventable things that could have, well, diseases that could be prevented or health issues that can be prevented because of lack of treatment and lack of attention. And it's already piling up. Think about mental health issues,
Yeah.
where now there used to be a waiting list of about 8 months to a year. I fear that it's going to take longer for people to get seen for mental health issues, and that's a huge worry for me. I
Mhm.
believe there's going to be an increase in home related injuries for children and for even vulnerable women. Although I did say that, being at home and being with your partner is a good thing to get close, unfortunately there are still relationships where husbands and wives don't get along very well, and the fact that they are in the same room 24/7 can lead to a lot more frustration and conflicts, and children will end up being the victims of that. So I see that at the practice just last week. I'll tell you a little anecdote. A man in his late 60s came and he said that he had about a very slight episode of feeling a little bit dizzy at 12 in the afternoon. It was quite interesting how he remembered the time. and it only happened very slightly, but he felt much better. But he just wanted to come to the GP practice and have his blood pressure measured, because you never know what it is. So we fitted him because he had risk factors. So he came in, and I talked to him, and I said to him, "So what's going on?" And he gave me this long story. But it turns out that he's actually a little bit worried because he's concerned that if he gets corona, what's going to happen to his girlfriend who's in her 80s at home? So I thought his partner, his girlfriend, was suffering from a terminal illness and
Yeah.
was just about to die. And I'm like, "Oh, I'm so sorry, you must be really worried about her because she must be suffering from this disease." He's like, "No, she's perfectly healthy." I'm like, "Well, then,
What's the
what's your
problem?
problem?" And then he's like, "Well, sometimes during relationships, there's all these problems that occur." And I'm like, "Aha!" So this guy is now stuck with
Ah.
his girlfriend for 2 3 weeks, and now things are things are boiling up, and he wants somebody to talk to about.
Oh, wow.
Yeah.
So you've become this
Yeah, so
therapist at that
GPs,
point.
yeah, GPs will have to be more, they're already multitasking. We're going to be double multitasking. You're going
Yeah,
to be listening to a lot of different issues. And I think that this situation we're in is going to actually open up a whole different world of
oh,
illnesses and ways that we handle illnesses. And the
yeah,
last thing I want to just touch upon is that I'm hoping that this will also open the world to the fact that as human beings, as patients, we can actually monitor our health even better, and we can monitor our health even better from a distance and just inform our GPs when things are getting out of hand. And I'm hoping that this will be a new journey to allowing electronics and gadgets that we use to monitor our health to
yeah,
help communicate between doctors and patients. And I'm talking about things like just a thermometer or blood pressure measurement or a saturation meter. Have those things at home because it's going to help you empower your health and say, "Okay, today's a good day because I'm actually, although I don't feel that well, I've
yeah,
measured my blood pressure, I've measured my temperature, I've measured my oxygen levels, and they're all good. So this might not be as bad as it is, and I don't need to have to go all the way to the GP for that." So I'm hoping that this will lead us to a different mindset in the way we handle our bodies and how we
yeah.
monitor vital signs.
Most definitely, definitely, and I hope it will also help us to appreciate each other a bit more, even
Absolutely.
though we're isolated, like we're on each other's breathing on each other's necks
Yeah.
indoors,
And we
literally.
should, yeah, we should be breathing more, and we should appreciate each other more, even though we're at home. And we should be distancing ourselves from people that we don't know. But when you're home, tell your loved ones you love them. Make sure you give them a hug and a kiss, because this virus, we don't know where it's gonna go.
Yeah,
Talk about what's going on. Even if you can't talk about it, I know I'm not a very good talker when it comes to these kind of things.
mhm,
Write it down. Express your feelings better. Learn to be more receptive of other people's ways of life, and embracing. And I think I believe that this is a new era for a change, and we're seeing it in all types of ways. I'm looking at parents jogging outside with their children. I never saw that before, and I
yeah,
think people are getting together in good ways. They're more conscious about their health. So there are positive things to draw from this, but please keep to the distance. If you're sick and you don't feel well, let somebody know. Don't just say, "Oh, I can't talk to a doctor." That's what Hello Doc is here for. Let
yeah,
us know, and we'll try and help you sort it out.
yeah. I love that. I love that. It kind of gives us kind of hope that there is somebody who's willing to listen to us and learn more
Absolutely.
what we're going through, both in our minds and in our body. So, last before we round up, could you share with our listeners about Hello Doc, how people can access it, especially during this time,
Yeah.
and where they can find you and what type of questions or complaints relating to this topic within their bodies, whatever is going on, could they come to you with? Could you share a bit about that?
Sure. So we are based in the Netherlands, obviously. So they can go to www.hellodoc.nl. The website in itself is just informative. If you click on
Yeah,
sign up, it will take you to the platform where you create an account. And once you create an account, you are going to go through a journey. I have an amazing team, and they are there 24/7 to listen to what's going on. And basically, what happens is that depending on your complaints, they my team of let's say, they triage the complaints, and then they link you to the best doctor for you, and not only the one that speaks your language, but also the ones that is available when you're ready. So we're very much a team, a strong team of five people, and we are there, and we're growing. So we're growing our team because the demand is also growing. We basically want to be there for those who don't have a GP yet. And if you don't have a GP or you can't get registered to a GP, we help
Yeah.
you get that registration done. So we look around your where you live, and we monitor closely GPs that are taking new registrations. So once they say, okay, we're open for new patients, we give you their number so that you can call and get registered. But we know that for a lot of expats and foreign students who are coming to the Netherlands, it's pretty hard now to get a GP. So we want to just offer that temporary care, that, bridge that gap, and get you the medication that you need for the temporary moment, or the referrals that you need, or just the care and attention. That's what we're good at. So
Hmm.
yeah, and you can contact us anytime throughout the day. We are always around, and you'll get a welcome message, and then you'll be linked to a doctor in no time. The
Yeah.
services at the moment are paid, and a lot more information about that is on our website. But for corona, like questions or symptoms, you can get a free consultation. So that's something that we want to give out there to
Yeah.
contribute to this very uncertain time.
Yeah. Very, very, very relevant for this time.
Yeah,
So that free consultation, how does that go? Does one have to sign up as well before he
yeah.
gets the consultation? Could you give us a bit of logistical information about that?
Yeah, so the again, you if you sign up for the consultation, there's always links available on these different social media platform. But
Yeah.
basically, you will need to register on our platform, create an account, because everything's done through a secure platform,
Yeah.
with end-to-end encryption, because obviously privacy issues. So we maintain that, those guidelines, let's say. So once you've signed up, you can then access our calendar, the Corona consultation calendar, and then click
Yeah.
on the first slot available for you. And then I'll be online, or one of my other doctors online, and we'll just take your call, we'll listen to you. And
Yeah.
then we always, for every single video consultation, we always provide all our clients with a summary. And
Hmm.
that summary has a detailed account of what we talked about, and it also suggests tips and recommendations. And if you don't have a GP, we will also offer you 2 or 3 GPs in your neighborhood where we've been monitoring whether or not they're accepting patients, and then we can give those details to you so that you do apply with a GP.
Great, excellent.
Yeah.
So also what we want to know, we know where to follow you. I shared also the link for those of you listening on Facebook, Hello Doc, how you can access it. Also getting your free consultation, very relevant for this time.
Yeah.
Could you, in the last like minute, share your piece of advice for people to do, how to act going through this? And the actual advice that is legitimate, strong, truthful, that could help people on their way during this period.
Yeah, I'm just gonna hold on. Just my phone
Sure,
is gonna.
sure.
Yeah, sorry, technology.
I know it needs a
Okay.
battery and
Yeah.
everything.
Um, well, the last piece of advice I want to give to everybody is to hold
Light as well. No
is
biggie.
first of all to I want to say stay calm, but I don't think that's the right word, because everybody is being pretty calm. So I'm glad about that. What I want to tell people is that whatever you see on social media, just ask yourself, is that a relevant source? Where's that coming from?
Hmm.
Simply because there's a lot of stuff going on out there, and we want people to be on the same page when it comes to this, because the more on the same page we are, the best it is for health professionals to do their jobs, and to also for politicians to be able to access the right resources in order to help people. The last thing I want people to know is that we are going to get through this, right?
Yeah,
There's no other way I can confirm this. We're going to get through this. It
yeah,
might take a few months. It might take, even worst case scenario, it takes a year. After that year, how wonderful would it be to say, haha, we got through this, we can actually breathe again. We can actually live in a world that where the air is fresh, where the sea is blue again,
Oh yeah.
where nature is thriving.
Hmm.
That's what this is also going to be an eye opener for. Okay, medical issues will always persist. You're important to us because obviously we're doctors and we want to help you. But more importantly, we want to help you maintain a good balance with your mind, with your health, and with your physique.
Yeah.
So, for us to be able to achieve that goal, we all need to be on the same page. And that same page means reliable sources, following the advice, and keeping our head calm.
Mhm.
Okay, that's the only thing I can say to you right now. And
Yeah.
that's why Hello Doc is here, because I want you guys to know that I'm here to listen to you guys. I'm here to make sure that you guys are safe, you guys are happy, are enjoying yourself. It's a very uncertain time, but
Mhm.
it's going to be okay. We're going to be fine.
Yeah. Yeah, on that note, I'm taking it to heart.
Yeah.
Since that comes from a doctor.
And I'm not at all saying that all the people who've lost loved ones, we're not respecting them. I believe that they are victims of an unfortunate situation. There are heroes who have lost their lives to fighting this
Oh,
coronavirus, and they are
yeah,
always in my thoughts. But for the remaining of us, we need, for the sake of those that have unfortunately passed away, we need to do things differently in order
yeah,
for us and the next generation to be able to, have fulfillment from this.
yeah,
Again, look at what's happening around us. We need to be to we have to work together on this one. We can't do it on our own.
yeah. Absolutely, and also have taken a distance. I think this also excludes for the ladies. Our nail appointments we really have to cancel.
Yeah, look at my hair. I still need to get my hair done. know. So
Some of us
yeah,
are suffering in different ways, and
yeah,
I guess it's also like for beauty things, right? You also
yeah.
don't recommend for people to do it secretly, and you know um
No, it's really not worth it. I mean, at the end of the day, I understand that you want to go into somebody's, house, and of course you want to make money. Obviously, yeah, you want to keep your business up, and you
yeah,
want to look good. Absolutely, I hear all that. I understand all that.
yeah,
Maybe it's a topic for another time. Okay, if you really want to go, what can you do to stay safe, right? I'll be more than happy to share
yeah,
some tips about the moments like women who want to get their hair done, who want to have their nails done, and it
yeah,
is gonna happen. There's gonna be some underground things going on, so, some stuff happening at 10 o'clock in somebody's backyard. I get that, right? But then let's talk about doing it safe. Nobody's saying
right,
don't do it. In the sense that it's against the law, but if you're gonna do it, just to be conscious of what you're doing. And if somebody's literally saying to you, "I can see you right now, but I'm having a bit of a fever and I'm coughing," maybe then you should be like, okay, I'll let my nails wait another week or two.
yeah, yeah.
Yeah,
Yeah, exactly. Exactly. And
yeah.
with that said, Dr. Sabine, I so much want to thank you for your
I
time.
thank you.
I know it's busy on your end. You are having to go through another busy week, and just
Always.
making some time out to talk to a bit of our our facts concerning this COVID-19 is really there to make sure that we ensure that we are safe.
Yeah,
For myself, having somebody that I know recently passed away off of it, I'm really like on this as in like, hey, let's take the needed measures for it and let's make sure that we get through this, well.
yeah.
And
And again, I'm really sorry about your loss. And I know that
yeah,
one of the things that I'm realizing more and more is that we're gonna find out a lot more of people that we know
yeah,
directly, indirectly, are going to be affected by this, because it's a serious thing. It really is. But despite of the seriousness, um, put them close to your heart. Make sure that you are doing what's right for you and your children and your family. And we'll be fine. I promise you. We just have to
yeah,
stick together and still talk about your medical issues. Do not let it wait. And that's again some of the things that we're very good at doing. Hello, doc. Those
yeah.
little medical issues that need some treatments. We're happy to take care of those. Yeah.
Absolutely. Well, thanks again. And also shout out on the last one to Elton Mujaz Vivi, who says, so happy to see Dr. Sabine on your show. So that's a fan, I would say.
He's got how many claps? One, two, three. Yeah, he's a big he's a big fan.
He's a big fan.
Yeah,
Again, thanks so much for
you're
informing
welcome.
us. Thank
Anytime.
you. And hopefully, when something else happens, I will touch base with you and see
Yeah,
if we can steal some of your time, to get some expertise on
a-
some of this.
anytime. That's really what I'm here for. I mean it.
Yeah,
Anytime, Miss Abba. You have me
excellent.
any call. 2 o'clock in the morning, I'm right here.
Excellent. Thanks
Okay.
again for joining us. Have a good evening, and we'll keep in touch this week. And
Yeah.
a big God bless to you.
You too, Miss Abba. Take care and
Okay,
stay safe. And my
you.
regards to your friends and family.
Definitely, as for sure.
Okay. Thank you.
Okay, bye bye.
Bye.
And thank you to all of you who just tuned in to listen. Kimo Kamara, who just joined and who said, you know what, good conversation. Thank you for sharing those good information, and thank you for linking us because Dr. Sabine is a contact that I discovered at a my OMEC event. You just listened to Africa on Focus right from right from my living room, and I can't play the music as I normally do, but hopefully next week I'll be back with another expert. We're working on that and talk about some of the facts, some of the knowledge, some of the things that we really should know in this time. Very big God bless to all of you. Make sure that you stay safe, stay isolated on a positive note. And, make sure that you don't become fearful and do things out of panic. That is also very important. Feel free to share this show on your timeline, wherever that you are. And also make sure that you spread the word. Look out for Africa on Focus, the podcast, because there is where we broadcast the recaps of the conversation that we had. I am Miss Aba. I'll be back with you next week. Stay safe. Make sure that you follow me on Instagram, Facebook, which is Miss Aba, MS.ABA. On Twitter as well, this is Miss Aba, and engage with us in conversations regarding our health, regarding our community, and regarding empowering one another. Have a good week and, stay safe. Love and light.